We will be talking about Chapter 18 today, which is the urinary system. So the main organ of the urinary system is going to be the kidneys. They're responsible for the actual formation of urine. So they're located under the muscles found in the back, behind the parietal peritoneum, just above the waistline. So if it's located behind the parietal peritoneum, that's referred to as retroperitoneal. Excuse me. So it actually sits outside of the peritoneum. The right kidney is going to be just a little bit lower than the left. They are protected by the lower rib cage, and then they're also surrounded by a renal fat pad, which encases the kidneys and holds them in place. The internal anatomy is going to be composed of a couple of different areas or components. So the first one is the renal cortex, which is the outer layer of the kidney. And then the inner portion is going to be called the renal medulla, and that is composed of the renal pyramids, which are triangular divisions of the medulla. Then we have the renal papilla, which are the narrow innermost end of the pyramid. The renal pelvis is going to be an extension of the upper end of the ureter, but it lies inside the kidneys. And then the calyx or calyces are divisions of the renal pelvis. So this shows where the kidneys sit in relation to everything else. So you can see right kidney is just a little bit lower than the left. And then we have the ureters, which come off here, bladder, and then the urethra down below. So here is the internal structure of the kidneys. So it's going to be surrounded by a fibrous capsule on the outside. And then, of course, we have that renal fat pad that completely encases the kidney. Then we get into the cortex here. This section all around is going to be the medulla, and then you can see those medullary pyramids, the renal papilla of the pyramid, and then the calyces are going to be these subdivisions here. So they kind of lead from the ureter up into the kidney. And then the hilum is going to be this medial indentation here. So now if we look at the microscopic structure, we're going to have a couple of different areas that we'll talk about. So the two main areas are the renal corpuscle and the renal tubule. And then those are each kind of subdivided into different areas or components. So the renal corpuscle is made up of Bowman's capsules, which is going to be the top of a nephron, which is the microscopic unit of a kidney, and then the glomerulus, which is a network of blood capillaries tucked into the Bowman capsule. So the kidneys are going to be made up of millions of these microscopic units, the nephrons, and then the nephrons themselves are composed of the renal corpuscle and the renal tubule. The renal corpuscle is going to be divided into the two parts, so Bowman capsule and the glomerulus, and then the renal tubule is going to be divided into four different parts. So we have the proximal convoluted tubule, nephron loop or Henle loop, the distal convoluted tubule, and then the collecting duct. So the proximal is going to be the first segment of the renal tubule. The nephron is an extension of that. It's going to be made up of a straight descending limb, a hairpin turn, and then a straight ascending limb. And that will take us to the distal convoluted tubule, and then to the collecting duct. So here shows the renal corpuscle. So inside is going to be the glomerulus, and then Bowman capsule is on the outside. Then we are going to have the proximal convoluted tubule, the nephron loop here, and then the distal convoluted tubule, which is going to lead to the collecting duct down here. You can see it on this one. So here's the renal corpuscle, proximal convoluted tubule, nephron loop, distal convoluted tubule, and then the collecting duct down here. And this gives us kind of a look at the closer look at the renal corpuscle. So here you can see the glomerulus, and then surrounding it is the Bowman capsule. So the main functions of the kidneys are going to be to excrete toxins and nitrogenous waste, regulate levels of chemicals, maintain water balance, blood pressure, and then secretes erythropoietin. So really the main function of the kidneys is going to be homeostasis. If the kidneys start to fail for whatever reason, the body will not be able to maintain that homeostasis. So the erythropoietin is a hormone that's going to stimulate the additional production of red blood cells during hypoxia. So during a state of low oxygen levels in the blood, it will stimulate red blood cells production. So the formation of urine is going to take place in 3 processes. So the first is going to be filtration, and then we have reabsorption, and then secretion. So filtration is going to occur in the renal corpuscles. So again, that's the glomerulus, which is the network of blood capillaries, which is then surrounded by the Bowman capsules. So renal corpuscles are glomerulus and Bowman capsules. The blood pressure inside of the glomerulus, so those blood capillaries, is going to cause water and dissolved substances to filter out into the Bowman capsule. So if we look back here, you can see that there's a space, kind of a hollow space surrounding that glomerulus. So the water, dissolved substances are going to filter out of the blood capillary here and then go into the Bowman capsule. So this is kind of a collecting area, and then it's going to go down into the proximal tubule here. So reabsorption is going to be the movement of substances out of the renal tubules into the blood through the peritubular capillaries. So there's capillaries that surround all of these renal tubules. So the water and dissolved substances are going to move out of the renal tubules into the blood, and then they're going to reabsorb through osmosis. So reabsorption is going to move substances from urine into the bloodstream. The body is going to kind of determine what it needs, what it doesn't need, that sort of thing. So if there's a certain ion or something like that that the body doesn't need, then secretion will occur, which is the movement of substances back into the urine from the peritubular capillaries. So secretion is essentially reabsorption reversed. So during reabsorption, the body is reabsorbing those water, nutrients, ions, that sort of thing. So it's moving substances from the urine into the bloodstream. And then secretion is going to move substances from blood into the urine. So hydrogen, potassium, certain drugs, ammonia, those sort of things are all going to move from the blood into the urine to be excreted from the body. So this kind of shows where those different processes are going to take place. So you can see the green arrow here matches up with filtration. So that occurs at the renal corpuscle. And then we have reabsorption at the proximal tubule, and then both reabsorption and secretion in the kind of distal tubule and collecting duct. And this table is in your book, but it kind of breaks down the part of the nephron and then what process it plays in urine formation and which substances are moved in that area. So to control the amount of urine that is being produced, we have a couple of different hormones that are going to act on the system. So the first one is the antidiuretic hormone, or ADH, and this is secreted from the posterior pituitary gland. It's going to decrease the amount of urine by making the collecting ducts permeable to water. So if those ducts are permeable to water, water is going to be reabsorbed into the body, resulting in that water retention. So there's less water being produced in the urine or being secreted back into the urine. It's staying inside the body. So we will have a decreased amount of urine. Aldosterone is going to be secreted by the adrenal cortex, and this is going to stimulate the tubules to reabsorb sodium at a faster rate. So water is going to follow that sodium by osmosis. So an increase in sodium reabsorption results in an increase in water reabsorption. So we're looking at less urine volume with aldosterone. And then the atrial natriuretic hormone, or ANH, is going to actually have the opposite effect of aldosterone. So this is secreted from the heart's atrial wall, and it's going to stimulate the kidney tubules to secrete more sodium and lose water. So it's going to cause an increase in sodium and water secretion. So the body is secreting the sodium and water back into the urine, which is going to result in increased urine volume. We can have some abnormalities associated with the urine volume. So anuria is the absence of urine. Oliguria is a scanty amount of urine, so a decreased amount, and then polyuria is an unusually large amount of urine. So just for comparison, a normal adult urine output is considered to be 1,500 to 1,600 milliliters a day. So everything that we've discussed up until this point has taken place in the kidneys. So they're primarily responsible for the formation of urine. And then the three remaining structures that we'll talk about are going to be responsible for the elimination of urine. So the first one is ureters. These are going to connect the kidney to the urinary bladder. So their main function is to drain urine from the renal pelvis to the urinary bladder. And we need something besides just gravity to help move the urine from the kidneys to the urinary bladder. So peristalsis actually takes place in the ureters. This is because if we're laying down, flat on our back or whatever, we won't be able to rely on gravity to move the urine from the kidneys to the bladder. So that peristalsis has to kick in and help move the urine. So this kind of shows the inside of the ureter. So you can see there's a lumen here, or the opening, and then transitional epithelium surrounding. And then a layer of smooth muscle here. So the smooth muscle is what gives us the peristalsis movement, and the transitional epithelium allows for that urine, or the ureter to stretch as it fills with urine as it's being propelled through. So once it makes its way through the ureter, the urine will be deposited into the urinary bladder. So this is an elastic muscular organ capable of great expansion. So this is really important to allow us to hold that urine so we don't have to void constantly. So lined with a mucous membrane arranged in rugae. So that's those folds that you'll find. So when the bladder is filled, it's actually able to stretch those folds out and really expand in size. So main functions are going to be storage of urine before voiding, and then actually it plays a role in voiding the urine. So here we can see the structure of the bladder. So this would be the bladder here. Ureters kind of come behind and then secrete the urine into the bladder. Males are going to sit directly above the prostate gland, and then females, you find the bladder underneath, kind of tucked into the uterus. So the last structure that we will talk about with this is the urethra. So this is going to extend from the urinary bladder to the exterior opening, lined with a mucous membrane. The opening of the urethra is going to be referred to as the urinary meatus. So the urethra is a pretty narrow tube, and then it's about 4 centimeters long in women and about 8 centimeters long in males. So the fact that a woman's urethra is so short, and that it is located close to the anus, this is what results in women having urinary tract infections more often and bladder infections. So once an infection gets into that mucous membrane of the urethra, it's pretty easy, specifically in women, for it to travel clear up to the bladder and that infection to spread. So main roles of the urethra are going to be passage of urine from the bladder to the exterior of the body. So that goes for men and women. And then specifically in males, the urethra is going to play a role as a passageway for the movement of semen. So micturition is going to be the actual passage of urine from the body, so urination or voiding. This is going to be controlled by regulatory sphincters. So we have two, the internal urethral sphincter and the external urethral sphincter. So internal is going to be involuntary and external is voluntary. So once the bladder fills to a certain point, that internal sphincter will open, and then we kind of think when we sit down or to void, then we open up the external sphincter. The bladder is, it allows a lot of storage of urine with actually a little increase in pressure. So most people will notice that they need to go to the bathroom at about 150 milliliters, but most adults actually void about 350. So the bladder can increase the amount of urine that it's holding quite a bit without a lot of notice in increased pressure. So the emptying reflex is what occurs when we void or urinate. So this is a process that can be voluntarily suppressed until the bladder is filled to capacity, and then control would be lost. So it's initiated by the stretch reflex in the bladder. So the bladder is going to stretch to a certain size, and then the bladder wall is going to contract. When that occurs, the internal sphincter relaxes. So that is the involuntary part, and then we voluntarily relax the external sphincter and urination occurs. So some issues that can occur with micturition is going to be urinary retention, which is when urine is produced but not voided. So with that, that means that the kidneys are functioning properly, but there's an issue either with the bladder or the urethra. Urinary suppression means that no urine is produced, but the bladder is normal, so that might indicate an issue with the kidneys. And then urinary incontinence is when urine is voided involuntarily. This occurs commonly with elderly people. Stress incontinence also occurs with mothers, so that's urine loss associated with laughing, coughing, heavy lifting, that sort of thing. And then reflex incontinence is associated with a nervous system disorder, so could be caused by spinal injury, something like that. A urinalysis can be performed to determine, signs of a disease, if kidneys are functioning properly, that sort of thing. So physical, chemical, and microscopic examination of urine. So what they're looking for is changes in the normal characteristics or the appearance of abnormal urine characteristics. So this isn't just for the kidneys. This could also show, if there's an excessive amount of a certain sodium or potassium, something along those lines. And that is chapter 18. If you have any questions, just email me and let me know.